Welcome to Advancing Health. Healthcare and the state of medicine in general has made remarkable progress across many fronts in the past couple of decades. Delivering to patients on all that potential and promise is a separate challenge, one that Jefferson Health is tackling head-on.
Thank you, everyone, for joining us on another episode of Advancing Health. I'm Dr. Chris Durienzo, AHA's Chief Physician Executive, and today I get to talk to someone I have known for 20 years. We were kids together in medicine way back in the day. Today, he's the president of Jefferson Health. Baligh Yehia, thank you so much for joining the podcast.
Thanks, Chris. It's great to be with you and good to see you again.
Always, my friend. We know that Jefferson Health has gone through a lot of evolution in the past few years. I want to start by asking you to tell us a little bit about the various communities that you serve and about Jefferson Health.
Jefferson is going through a lot of changes, but it's been around for more than 200 years. And the exciting parts about Jefferson are we bring together a 200 plus year university, medical college, nursing, all the health professions, as well as a really robust undergrad program, with the health system that's now 33 hospitals across Eastern PA and Southern New Jersey, and a health plan with more than 400,000 covered lives, primarily in Medicaid, Medicare Advantage, and ACA. And that's the special thing about Jefferson, and why I love the work that we do is really how do you connect the academic and research mission with the clinical care and also the payer side. And it creates for unique opportunities. Just last year, we hired about 1,000 individuals that graduated from our university into the healthcare system. Pipeline programs, whether it's nursing or pharmacy or all kinds of different technologists, being able to actually train at the university and then be able to work in the health system is a great way to keep people in the community and also to provide upward mobility. And then similarly on the health plan side, we overlap on thousands and thousands of patients and thinking about how we can deliver better care in the context of value. And that stuff is really, really exciting. It's that intersectionality between those three different areas where we see some uniqueness that maybe isn't seen in other healthcare systems.
We know that with that kind of great opportunities, there are also challenges that health systems face. It is not an easy operating environment, and especially as a health system that is growing and is continuing to integrate across all of your operating areas and the communities that you serve. What would you tell listeners are some of the biggest challenges that you, as the president of that health system, are trying to solve today?
You know, for us, there's probably a few that come top of mind. I think healthcare is changing very rapidly, in some ways, amazingly exciting when you think about the type of therapies that are coming down the pike, when you look at immunotherapies, gene therapies, things that we weren't even thinking were possible 5 or 10 years ago. You know, we're doing treatments for sickle cell disease that if you've ever taken care of someone or had it yourself, very challenging, hard condition. And now there's a way that you can actually live without having any of those complications. I mean, that's pretty amazing, very different than when I trained as a resident. Similarly, all the technology changes that are happening. So there's that context of how do we adapt to changing technologies and changing therapies. But across that is really this bigger and bigger divide between what it costs to deliver care and then what you get paid to deliver that care. And that's what I see in general as one of our biggest challenges, particularly in Pennsylvania and in Southern New Jersey, where our imperative is to deliver high quality, high value care. But every day it seems like there's different type of policies coming out from payers. It seems like there's a lot of challenges from pharmaceutical companies for different programs. And, that's one of the things that I think a lot about is how do we make sure that we close that gap between what it takes to make sure that we deliver exceptional care and take care of our employees and support the communities, while at the same time knowing that there's revenue issues that come from both federal, state, and commercial payers.
It's certainly a challenge that's faced in Pennsylvania and in health systems across the country. You described a multi-part mission, given Jefferson Health's academic mission, your research mission, your community mission. We had conversations with a few other physician leaders a couple months ago, actually, about how to bridge those massive novel innovations on the research side, gene editing therapies, with the functional challenge of implementing in largely a community health system. Because while we have these academic centers, most of healthcare is delivered in community hospitals and in practices across the country. So given the footprint that you described and the impressive amount of infrastructure that Jefferson has, what are you doing to meet the challenge not only of ensuring sustainability of operations, especially in communities that otherwise may not have access to care, but also to bring that leading edge innovation as far out to people across the states that you serve?
I think that's like a critical question. And, at the heart of it, it comes down to access. And here at Jefferson Health, we have a bold goal to be the most accessible system in our region and ultimately in the country. And when you think about our footprint of hospitals and clinics, as I mentioned, there's 33 of them, but we don't do every service at every single location. And so then the question becomes, how do you reach people in rural communities, which we serve in the middle of the state, to highly urban communities like in Philadelphia? And that's the power of being part of a network. And so for us, as we think about how we evolve and change, it's really around our service lines and our clinical programs. And we've challenged our teams to think differently about access. And I'll give you an example. One of the most challenging diagnoses you can get or give to a patient if you're a caregiver is one of, hey, we think you might have cancer, or we're seeing something that doesn't look right. Typically, then you go and have to get different tests and find appointments. And during that time period, there's a ton of worry, there's a lot of uncertainty and concern. And so we've pushed our team and said, how do we remove that? And we created a program, our same day, next day cancer program. We're actually able to see new cancer diagnoses within 1.4 days at Jefferson. And it's mostly virtual. It extends into the evening hours as well as on Saturdays. And we're able to provide some comfort and, most importantly, take away some of that uncertainty about what's the next step and where do we go from here. And when we first talked with the team, it seemed almost impossible. Of like, how can you actually do that? And we worked to create the right model. We set it on top of our clinics versus trying to embed it in the clinics. And that's been wildly successful. And we've seen many patients go through that program, more than 2,000. We've seen a faster time to chemotherapy and surgery. And as I said, there's that intangible peace of mind that comes. And so we've been asking each of our different services to think about things like that. How can you push differently? Our virtual primary care program, which now represents more than 10% of all of our primary care visits, we have to double the program because of the amount of interest in it. And then we also have home-based care where we're actually getting into people's homes to help provide that. So I think when it gets to these novel therapies, I think virtual is our friend. And the concept of being able to rotate clinicians, be able to meet people where they are in their communities is really important. That's something that's really exciting around being part of a network like Jefferson is whether you're in Schuylkill County or in the Poconos or in Scranton, you can enroll in our clinical trials that are coming out of Philadelphia or out of Allentown, or you can get access to a world-class and novel therapies that wasn't available to those communities before. And it's really about connecting the dots through that system. So, access continues to be something that we've talked about for decades now, and it's something that we'll continue to work on. But I think we're making some headway here in some of the programs we've developed.
Well, given as long as I have known you, it is no surprise to me, Baligh, that if I were to summarize what I just heard in short, it's meeting an intersection of innovation and implementation. I was on a very special episode of this podcast recently with three of the coolest physicians not named Baligh Yehia in America. That was with Jackie Gerhardt from Epic, Tom McGinn from Common Spirit, and Zia Aga from the West Health Institute. We were trying to envision what our profession looks like in 20 years as we walk through this era of AI-enabled technology change. And one of the things that came up, you just reinforced, which is sometimes we can think about access differently. If I think about the patients who I remember seeing in pediatric residency, newly diagnosed cancer, there's a subset of those patients who it's truly an oncological emergency and they have to be admitted to a hospital immediately. Perhaps they have something like leukemia and they're in a leukemic crisis. But for many of them, what they need first is a conversation. And we know that there are ways that we can enable those conversations with an expert in the field to talk me through what happens next. That doesn't require a hospital stay. It may not even require going to the ER or coming to an office. And as we enable clinicians to deliver care and to use their expertise at the top of their license in different ways, we can solve for access differently. And so the next question I typically ask guests is, how's it going? It sounds like it's going pretty darn well.
Yeah, and I think, like I said, it's an issue that's been facing medicine for a long time, and it's multifactorial. We talk about physician and nursing shortages. We talk about disparities in care and how do you get access to treatments in one location to another. And so, those still exist, but we are making progress. And I think that's really exciting when I hear stories of individuals that might not be able to access novel therapies. We just started a new program where we're screening for cancer in the ERs. And one of my colleagues sent me a note last night. The program just started. We've scheduled 80 colonoscopies. We've had 4 done. And one of them, we've diagnosed someone with a mass already. And that's someone that probably was not seeing primary care, came into the ER for something different. It's not an emergency. So typically ER doctors and teams are not screening for cancer. And so it's things like that in my mind are being able to meet people where they are. It sounds very simple, but that's an example. They're there waiting to be seen or in the room, and our team is able to talk to them and then evaluate them, get them scheduled, and go from there. And the other cool thing is that patient was a member of our health plan. And so that's kind of neat where you see win-win-win for most importantly, helping the patient and their family, providing better care, and then also improving the lives of those in our health plan.
We have time for exactly one more question. And I'm torn because, again, we've known each other for 20 years. And there are a lot of things that are just as true then as today. But I'm going to have to pen that question for another time because what our listeners tell us they most appreciate about our podcasts are we get to talk to fascinating people like you. And some of them come from academic systems, some from community systems, some are investor-owned or nonprofit or public health systems. And the biggest question that they always want to know is, it's amazing that you're doing this great work at Jefferson, but what advice would you give to me if I'm running a critical access hospital in Mississippi or I'm at a small academic health system in Oregon? You're doing this amazing work at the intersection of innovation and implementation to expand access. What first step should I be taking back home?
I think that's beautifully said and asked is that, we serve so many diverse communities, so different settings across this great country. And so for me, I would say, be curious, because there isn't really just a playbook that you can lift and shift. Maybe there's a baseline that you can start with that has to be adapted, but be curious. Ask patients, ask your patient family advisory councils, talk to your frontline staff. And again, it sounds basic, but that's what we do and that's how we learn. And make sure that as we deploy and implement programs, it actually sticks. And that's the one thing we are so prone, I think, to help. And sometimes that comes in the form of solving very quickly and taking time to, really sit with the problem that you're trying to solve, understand the problem you're trying to solve, talk to people about it. That planning, that discovery, that being curious goes a long, long way to executing on something that is efficient and that actually achieves what you're trying to achieve. So that's what I would say is just stay curious.
Very well said. If I've learned one thing in nearly 4 years at the AHA, and I've been to every conceivable kind of hospital in every conceivable kind of community in this country, it's while the role of hospitals look different from community to community, because every community is different, that connection point and the understanding of this is where I can best support my community needs is a common thread throughout. As expected, Baligh, it has been so much fun catching up with you. Congratulations on all the amazing work happening up in Philly and across your region. And thank you again to listeners for tuning in.
Pleasure. Thanks for having me.
Thanks for listening to Advancing Health. Please subscribe and rate us 5 stars on Apple Podcasts, Spotify, or wherever you get your podcasts.